afternoon, everybody. I'd like to welcome you to our ongoing webinar series from the SUA. Today we'll be talking about service equity in the AAAs around the area plan. Just a couple of things. You're all on mute today, and so as we move along, we want to encourage you to go ahead and chat your questions in the chat box, and as they pop up, we will answer your questions. Secondly, at the end of the broadcast, we will send out a survey for you to let us know how we did today. So please watch for that and fill it out for us, because your information, the feedback is really, really valuable to us. So with no further ado, we'll go ahead and start, and I'm going to pass it off to Jennifer Mead, and she can take it from here.
Great. Should we do a quick sound check? Is somebody willing to chat in whether they can hear us? Is somebody looking for somebody to chat and let us know that they can hear us? I'm wondering if we're still on mute, Christy, and if we need to repeat. I'm thinking maybe we're on mute. Should we try this again? Shall I do this? Let's see. So we're trying to check the sound here before we get going. If somebody's willing to chat in and let us know if they can hear us. All right. How about if I try this and then talk again?
And they just deliver twice? Yeah.
Hello, this is Christy Murphy with the SUA. Can you hear us? Can someone chat in and let us know if you can hear us? Yes. Yay, thank you. I'm sorry for the technical difficulties.
I'm worried that that's just Rhonda, and she's an organizer, so she can hear us.
Can someone other than the SUA team chat in and let us know that you can hear us, please?
Is there anything else we can do? Did we mute ourselves in the process? No.
Oh, you are heard by all. Okay.
But again, she's an organizer. I'm worried that it's only organizers that can hear us at this point.
Can someone, G. McPherson, can you chat in if you can hear us? Oh, the question box, they've all said yes, so they're in the question box. Okay. I'm sorry for the technical difficulties. We just want to make sure we have everything up and working and you can all hear us. Welcome to the SUA ongoing web series. Today it's about service equity in the area plan. And just a couple of things before we get going. We have you all on mute, so we'd like you to please chat your questions in, and we will answer them as we go along in the presentation. Also, at the end of the broadcast, we'll be sending out a survey for you to give us feedback on how we did today. We'd really appreciate it if you could take the time to do that for us so we can improve our webinars and make them meaningful to you. So with no further ado, I will pass this on to Jennifer Mead, and she'll take it from here.
Great. And I'm going to rely on you guys to try and hide the webcam because what we want to show is the PowerPoint and not us. And you managed to do that. Great. All right. Thank you. Sorry for the delay here. This is Jennifer Mead. I really appreciate you all joining us today. I think I know many of you. We've got a great group from across the state representing various AAAs on, and I know a good number of you, but for those of you who I don't know, I am part of the State Unit on Aging team. I serve as liaison to the area agencies on aging and ADRC in the metro area, and am the lead with the State Unit on Aging team on health-related projects. I'm not an expert on service equity, but I have a long-standing interest in this issue, and I'm really looking forward to reviewing the expectations for service equity in the area plans with you today. I'm also really happy to have with us today Naomi Sachs and Teresa Powell from APD's Advocacy and Development section. They've been involved with service equity in a variety of different ways on behalf of APD, so great to have them joining us to share some of what's going on. I think Christy covered the logistics. We will be archiving this webinar, and the PowerPoint will be posting those on the State Unit on Aging website after the webinar. There are a couple handouts. We'd sent some out in advance, but they should also be in the toolbar of the webinar if you didn't get those in advance. And it's hard to be interactive on a webinar, but we have included some polling questions as we go through, so we would ask you to try and humor us in responding to poll questions when those come up. It lets us know that you're still alive and out there. So moving on, good. Moving on to the slide, the overview. Here's an overview of what we'll be covering in the webinar today. We'll do a brief review of why we're addressing equity, why it's so important in the work we do. And again, as a part of this, I'm really pleased that Teresa Powell from the Advocacy and Development section of APD will share some of the work that APD is doing around service equity. We'll review the expectations for addressing service equity outlined in the area plan guidance. And we'll review some ideas on ways AAAs might think about considering equity in the different parts of your area plans. And then we really want to save some time at the end to answer any questions we don't get to during the course of the webinar, find out what other information you may need that we might be able to address, if not on this webinar, in the future. So why focus on equity? I think hopefully this is an answer we can all say because it's the right thing to do. It meets our mission. It's what we're all about. Inequity can be based on various differences among us, so race and ethnicity, income level, education level, occupation, geography, whether we're talking urban or rural areas, mental or physical disability status, the language we speak, our country of origin, immigration status, sexual orientation, gender identity. All of these can lead to inequities, and they're all important to us in trying to meet the needs of the older adults and people with disabilities that we serve. As AAAs and the State Unit on Aging, our mission is to address the health, independence, and well-being of older adults in our communities. And I think we'd all recognize that to be successful in impacting these outcomes, we have to be able to recognize and address inequities. But we'll take just a few moments up front to review some of the areas outlined on this slide. So Oregon isn't known as a terribly diverse state, but we actually do have an increasingly diverse population. The data on this slide is from the American Community Survey, which is part of the national census. And as you can see, between those who have an ethnicity of Hispanic or Latino, so about 12.5% of our population, and those who have a race that's non-white, which is about another 12%, about a quarter of our population now is racially or ethnically diverse. And that percent continues to grow. This is some further data from the American Community Survey. We can see that close to 10% of our population is foreign-born. Close to 15% speak a language other than English at home. 8% of our population are veterans. And for adults under 65, about 10% report a disability, and that number just increases as we get into older populations. The list on the left was a list recently put out by the Centers for Medicare and Medicaid Services, and it shows the leading non-English languages spoken in Oregon. At this point, actually, let's back up just for a sec. And at this point, we're going to just test out our polling here and run by you the first polling question, if we can make this work. All right. Hopefully, at this point, you are seeing a polling question that asks you, for which populations does your AAA do targeted outreach and services? And if you're willing to each take a moment and let us know, we'll see if this is working. There you go. All right, we're getting some answers. Good. And I think we probably can close. It doesn't take folks too long to do this. You can select all that apply. So go ahead and we'll go ahead and close it, and then we'll share with you what we're seeing. Perfect. Okay. So what we're seeing is a lot of you are serving groups that speak a language other than English, veterans. Everybody is serving rural and isolated older adults, and then smaller numbers of you are serving people with disabilities and the LGBTQ older adult population. So very interesting and great. Clearly everybody is involved in addressing the inequity already in some of the work you do. Are there any other populations? Feel free to chat in any other populations that you're specifically working at reaching out to. I'd be curious. Our polling system only allows for 4 or 5 options, and so we picked some, but feel free to chat in others as we move forward. All right. Moving on to the next slide. Good. Thank you. We've got a team here that's helping move us forward. Let me go. There we go. Sorry about the switching slides. So we know that different populations have different health outcomes based on their lived experience, where they grew up, their access to education and employment, their access to health and social services. And there's a tremendous amount of research that has been done on health and aging disparities based on these socioeconomic factors. This slide here and the next couple slides provide just a few examples of this. So this is a little bit of a random mishmash of information, but just to get us thinking about where inequity exists. So for people with disabilities in Oregon, much more likely to have, sorry, we need to end that. Yeah, thank you. Sorry. There we go. Thanks. Sorry about that. So for people with disabilities in Oregon, much more likely to have low household income, generally rate their health more poorly, much more likely to have diabetes and to smoke, less likely to be prepared for emergencies. And for African Americans and the Latino population, higher rates of poverty, higher rates of diabetes and dementia, and for African Americans, higher rates of stroke. On this next slide, some more examples. For American Indians, we've got higher rates of diabetes, stroke, heart disease, and dementia. For the LGBT population, higher rates of living alone and living in isolation, higher rates of tobacco and alcohol use. And for older adults with hearing loss, over half of people aged 70 to 79 and 80% of those 80 and older have difficulty hearing. And the research also shows that untreated hearing loss is associated with higher risks of social isolation, depression, dementia, and falls with injuries. So even if we have very small numbers of these various groups in the counties or regions that we serve, these may be exactly the people that it's most important for us to be thinking about reaching. So it's not necessarily numbers, but it's the level of need and the inequity of need that's important for us to be keeping in mind. Rural populations, I think everybody was indicating that they are doing outreach to rural and isolated populations, but I think fairly obviously often less access to services and greater transportation barriers. And then in terms of overall of racial, ethnic, and other minority groups, we know that these populations face greater challenges in accessing services generally, with a lack of culturally competent providers and social services, different cultural values that can make accessing services challenging, and generally a mistrust of organizations, and particularly organizations that control funding and services based on historical discrimination. So we know we have our work cut out for us. And the Department of Human Services has raised this as a priority and has developed a service equity framework, which we have posted on our State Unit on Aging website if any of you are curious to see what that looks like. At the State Unit on Aging level, we'll soon be starting work on our state level plan, which is required under the Older Americans Act in the same way that each of you is required to develop a AAA level area plan. And at the state level, we expect to be addressing service equity too as part of our plan. We recognize that there's a lot we should be doing at the state level to partner with statewide groups and organizations that can help reach populations at greater risk and to make materials available in other languages. APD has been actively engaging in soliciting input and expanding efforts to address equity. And before I let Teresa Powell jump in with a brief update on Senate Bill 21, we have another polling question that Naomi is helping us get geared up. So hopefully right now you are seeing another polling question, and the question is, have you ever heard of Senate Bill 21? We've got some yeses and no's and no maybes. That's good. Everybody's pretty definitive. All right, maybe we should close it and let people see what we're seeing. All right, so 73% of you said no, and 27% of you said yes. So that's helpful feedback for Teresa, who's going to give us a quick overview of what Senate Bill 21 is. And maybe we should, let me go ahead and hide this and move back to our slides. All right. Sorry. There we go. Thank you, Teresa.
Hi, Jennifer. Listen, I want to thank you for allowing myself and Naomi to be part of this great training that you're doing today. Now, so briefly, Senate Bill 21 is a bill that was passed March in 2013 from state legislators that requires DHS to create a plan to strengthen and improve services for older adults and people with disabilities. So in order to do that and have the collaboration of the community participation, DHS decided to have a steering committee. The steering committee was comprised of 19 people who are advocates, consumers, and state legislators. They come up with this plan on working on how to improve services in Oregon for, again, adults and people with disabilities, older adults and people with disabilities. And to do that, the steering committee decided to have subcommittees. And subcommittees was actually comprised of, again, stakeholders and consumers and advocates. And they decided to have 4 major areas to address. One is assessment, data and research, caregivers, and service equity, which is the topic that I would like to briefly talk about today. So with the service equity, Anne McQueen led that group, who is another co-worker of ours in the Advocacy and Development Unit. And she did a wonderful job, and we was charged with developing strategies to serve individuals equitably and in a culturally and linguistically responsive manner. And it was from the Senate bill in April 17th. So in doing so, we pulled together a group of stakeholders, like I said, and they came up with some amazing recommendations. At least 30, 40 people within Oregon, from all parts of Oregon, from the south and north of Oregon. And I just want to share some things that really was touched on that was really important issues, which was they felt that improving the quality of care in Oregon for people of color, of assessing and to do translation and interpretation for individuals that, of course, do not speak clear English, to do a lot more outreach for these communities that seem to have some disparities within receiving services. And the biggest other thing is engagement. We need to have more engagement for others to work with the inequities that seem to be approaching it in Oregon. Moving forward, because we had so many recommendations, our list was easy, over 50 recommendations that we should work on the state of Oregon. We didn't have time to really formalize how we're going to approach these issues that we're working with in Oregon. So our next steps are to form trainings and community tours and more stakeholders input, just to kind of have a real clear vision of where we're going and how we should address these concerns that was addressed in the recommendations of service equity subcommittees. And what we're going to do, if it's okay with Jennifer, is that we're going to post this information on ADRC, so you can see the list. That
Probably on the State Unit on Aging website. Yes.
Yes. Okay. Great. Thanks, Jennifer. Just so you can see more of listing of what was recommended in this subcommittee. Thanks so very much, Jennifer. I appreciate it.
Great. Thank you, Teresa. And we will make sure to post the Senate Bill 21 report on the State Unit on Aging website if folks are interested in seeing that and seeing where it progresses. All right, so moving on, equality versus equity. And I'm guessing that this is a familiar graphic for many of you. As the slide says, equity recognizes the barriers and obstacles that some of us face in reaching goals, while equality treats everyone the same whether or not they face obstacles. So the picture on the left depicts equality. Everyone gets the same help. Everyone has the same size box to stand on, but this equal help doesn't necessarily result in equal outcomes. We still have the short guy unable to see the ball game over the fence. The picture on the right depicts equity, where different people get different amounts of help to ensure the same outcome. And this can actually mean withholding some help for some people. We're not giving the tall guy a box because he really doesn't need it, and we're giving additional help to others. 1 box to the middle-sized guy and 2 boxes for the short guy, so that they all end up with the same outcomes. There clearly could be other ways of addressing equity. We could be lowering the fence. We could get some donated seats in the stands so that people could get over there and see it directly. There are different ways of going about addressing equity, but the idea is that we're really thinking about individual needs and not thinking that equality is going to result in the same outcomes for everybody. In the context of services, this can sometimes feel uncomfortable. We like equality. It's easier to say, okay, everybody gets the same thing. But addressing equity really means being thoughtful in how we use limited funds and staff, and potentially providing less support for some people who have other resources, but working to ensure that those at highest risk have similar opportunities and outcomes. So finally, in terms of equity, we really need to think about equity across the full spectrum of what we do. So planning, outreach, delivery of services, media, and written materials, and then the tracking, evaluation, and quality assurance of what we're doing. Equity and inclusion can't be kind of an afterthought or an add-on. And I've certainly fallen into this trap. We develop a great program or a brochure, and then at the end we say, oh, I wonder if we could maybe translate this into another language, or I wonder if we could adapt this slightly so it would work for the LGBT community. But what we really need to be doing is designing it and budgeting it with diverse populations and their needs at the forefront. So another quick polling question. In which areas is your AAA already addressing equity? And again, thinking of this across the span: planning, outreach and inclusion, the actual delivery of services, the communication that you do, the media messages and outreach, and then the tracking and the evaluation and quality assurance of what you do. So hopefully you're seeing a polling question now and be really interested in what areas that you feel like your AAA is already thinking about equity in the work that you do. Great, we're getting some good answers in. Thank you all for participating. And we'll give it another second here. It looks like people are thinking. And I think, again, you have the choice of selecting all that apply. So feel free to select those that do. Okay, so we should probably go ahead and close out here. And we'll let you see what we're seeing here. So the areas that people are doing the most in terms of thinking about equity are planning, and then the communication. So media, messages, outreach, probably translation of materials. And then slightly less, but still really doing well, outreach and inclusion, delivery of services, and then tracking, evaluation, and quality assurance, which is terrific. Glad to see that that's happening. All right. So moving on to the, yeah, okay. Actually, we've lost our cursor here to move on. There we go. Thank you. All right. So the Older Americans Act requires that AAAs develop area plans and makes a lot of references to prioritized groups. The list on this slide is all the references to various groups that I was able to find in the Older Americans Act. And I have to say the list is a little overwhelming. The Older Americans Act does expect that states and AAAs will find ways to supplement the limited federal funds that it provides with local or state public and private funds, but it's also clear that none of us are going to be able to provide everything to everyone. The AAAs need to focus efforts on those who have greatest risks and needs based on priorities and populations in your service area. And this will vary in every single community and by each AAA. This is one of the main things that the area plan asks AAAs to do, to identify the at-risk populations in your service area, and then to identify ways that you can best meet those needs. The Older, The Older Americans Act also includes language about reaching these targeted populations. And I won't read through all of these, but again, the Older Americans Act makes clear that the goal is to identify and effectively reach at-risk populations. Coordinating planning, setting specific objectives, doing outreach, and I think the last bullet on this slide is interesting. It also really expects that you as AAAs, when you're contracting services out, that you are including in agreements with the providers that you're working with requirements that those providers specify how they are going to also help make sure that they're reaching the targeted populations that you've identified. So thinking a little bit more about the expectations regarding service equity in the area plans. This is addressed in Section C of the Area Plan Instructions. And this Section C specifies that AAAs consider service equity and person-directed services in each area of their plans. Our webinar today is really focused on the service equity piece, but both of these are important. Our expectation is that this is not kind of a standalone thing that is separate from the rest of your area plan, but really something that's incorporated into each of the sections of the area plan and specifically into each of the focus areas. I think we've got another polling question for you at this point. We're curious about your role regarding the area plan. If you're a lead person in writing the plan, if you're one of a variety of people that are involved in putting the plan together, or if you're a community or advisory member involved, or other, the undefined other. And actually, if you're choosing other, if you're willing to chat in what your other is, that would be great. All right, good. We've got a lot of folks that are going to be actively involved in doing these plans. You're the right people to be on this webinar. All right, we'll share what we're seeing. And you can see that at least half of you will be the lead person in writing the plan. 36% are one of several people involved in providing input. And then about 18% are the mystery other, but I'm glad to have you on this webinar too. Presumably you're involved in some way. All right, so to help you think about how service equity may fit into your plans, we've developed a list of potential strategies and options. And to make clear, these are really just ideas. These are not required items that you need to include, but they're intended to give you some ideas, and they may be helpful. They may be things that you want to choose to include, but they may also prompt you to think of other ways that you want to address service equity across your area plan. We hope it gives you some ideas to start with and maybe can help generate other ideas. The list hopefully is something that you've already received. We tried to email it out, but it's also available on the State Unit on Aging website and should be also in the handout section of this webinar. Over the next few slides, we've pulled out a few examples from each section to review. So in terms of the overall area plan, the planning and service area profile, and the AAA administration sections that are the beginning parts of your area plan, we have a variety of examples of ways that you might be thinking about service equity. And again, these are just examples. And again, also to clarify, we're not expecting service equity to be a separate or standalone item, but really something that you consider in your overall plan. We are going to be looking for this as we're reading through plans once they're submitted on October 3rd. These two that we've included on this slide are, again, just examples to pull out. The first one deals with collecting and using participant data on race, ethnicity, and language and disability to determine if services are reaching at-risk populations. So your ability to use data to track that you're being effective in the services you've been provided. And what's included as the graphic is completely impossible to see. It's too small, but it is one of the reports that you can pull from the RTZ system. Fortunately, we have that now. You can pull INA calls by age, race, ethnicity, language, veteran status, and more, and is a great tool to be able to monitor what's happening in terms of services. The second bullet here is a suggestion around meaningful participation by diverse communities. And as noted earlier, our focus is really on finding ways to engage communities in all stages. So this might mean having a part of your area plan to do more in terms of including representatives from diverse populations on advisory groups, or it may include plans to have regular systems where AAA staff go out and meet with different organizations on their home turf, you know, talking with staff and consumers about their needs and concerns. A couple other ideas regarding planning and service area profile and AAA administration. Suggestions around partnering with existing groups and organizations to provide services. And I know a number of AAAs do this, partner with other organizations to help provide a variety of services. This allows the AAA to work through a trusted community organization. And again, could involve things like having AAA staff people available on an established schedule at another community organization's offices to help answer questions and provide services. It could involve having partner organizations help distribute information about services and resources on your behalf. And the second bullet deals with services in non-traditional settings. In the public health world, where I have done some of my work, there are interventions that have targeted older African American men and women that have recruited barbershops and hairdressers to talk with their consumers about heart disease. Health departments really weren't able to reach this population themselves, but by working through these trusted barbershops and hair salons, they could get their message out. And I know, again, that there are AAAs that have been working through faith communities or in partnership with specific language groups to try and get information out. And actually, I'd be curious if any of you are working with interesting partners that you're willing to share. Again, if you're willing to chat that in, that would be really interesting to get some additional examples. So then moving into the focus areas. And for each of the focus areas, you're asked to provide a very brief narrative addressing needs, and then use a goal and objective format to identify what your goals are for over the next 4 years. And again, with service equity, we want you to be keeping service equity in mind. It doesn't have to be a separate goal or objective, but rather we'll be looking to see that service equity is a part of what is influencing what you're doing in each of these focus areas. As we're reviewing your plans, we really want to see that service equity has been a part of the thinking in terms of what your goals are for the coming 4 years. For the first focus area, which is information and assistance services and ADRC, a couple examples here: requiring training for staff on collecting data from diverse communities. We know that staff and volunteers very often may be uncomfortable asking about race and ethnicity or other demographic information. So one possible approach is doing more training and role-playing, or finding staff who do this particularly well to coach others. A second idea is providing materials in a variety of formats and languages of populations in your service area. There is a handout that, again, attached to this webinar, and it's also on the State Unit on Aging website, on limited English proficiency requirements attached to federal funding. And it clarifies that there really is an expectation for federal agencies and for any program that receives federal funding to provide meaningful access to people who have limited English proficiency. For the focus area of nutrition, again, a couple examples. One idea is to target programming at meal sites to the interests and language abilities of culturally diverse populations. This includes things like nutrition education, having somebody who's bilingual on site who could provide information and assistance, and thinking about other services that might be based on the specific needs of that population. The second bullet regarding exploring options to think about family meals and any for populations where people may be unlikely to attend meals if family members can't attend, to think about creative ways where we can still use Older Americans Act funds to fund the older adults, but potentially other funds or partnerships to make meals available to people as in family units. For the focus area of health promotion, a couple ideas here: contracting with existing community organizations. I think a lot of you are doing this, contracting with tribes or organizations that serve specific language groups or LGBTQ elders, to think about doing Tai Chi or Living Well, some of the evidence-based programs, but specifically in the home environment of specific partner groups. For programs that are designed to be peer-led, and a number of them are, but the Stanford Self-Management or Living Well programs comes to mind for me, working really to recruit peer leaders that are representative of the groups that they're leading. So looking for Spanish-speaking peer leaders or Somali-speaking peer leaders, or finding ways to recruit people with disabilities to lead programs that are going to be targeted to individuals with disabilities. For the focus area addressing family caregivers, a couple more examples. Similar to health promotion, AAAs may propose plans to recruit volunteers from specific language or cultural groups to offer powerful tools or the other community programs that you may be already offering in English, but finding ways to target those to particular groups. AAAs may contract with existing organizations or individuals that serve a specific language group to let them know about family caregiving and respite services. There may be ways to creatively partner with community organizations where childcare is available. If you know you're reaching a community where there are sandwich generation adults that are unlikely to be able to attend family caregiving programs unless they bring their children with them. For the focus area of elder rights and legal assistance, and again, these are all the various focus areas that are included in the area plan that you're asked to address. And so again, just some more examples here. Ensuring that legal assistance and information on elder rights is made available in languages that are present in your service area. Information that is going to meet the needs of people who have low literacy or with disabilities. And so for this first bullet, really, when contracting with legal services providers, it's fair game for you to be asking about the language ability of staff or existing partnerships that legal services providers have with specific populations and their ability to serve diverse groups. The second bullet deals with working with community organizations that serve specific language groups as you're arranging to do information and outreach on legal services and elder rights. For example, a AAA could plan to forums or educational events addressing legal issues for same-sex relationships as a way to reach out and connect to LGBT elders, and then use that as an avenue for disseminating other information. For the focus area of older adult Native Americans, I'm hoping that all of you were able to listen in on the webinar in early March that Shelley Zylstra did. She did a great job with this, and her webinar got into far more detail than what we've included on our list. But that webinar focused a lot on relationship building. So in addition to the items listed here, AAAs may want to consider and propose as part of their plans ways to build more regular communication, really simply to build those relationships with any tribal partners in your service area, or perhaps cross-training of staff, ways to enable staff of tribal organizations and AAA staff to get to know and feel more comfortable with each other. So that moves us through the focus areas. And at this point, I think we want to check in with you and ask you for your feelings. And again, we're limited by the chat and question function, but we're interested in examples of what you're doing or ideas of what you're planning to include in terms of your area plans. Anything that we may have addressed here, or other things that you're willing to share. We can read them off if they come through. Either we've got a shy group, or people are have their own ideas and aren't ready to share them. So we can ask a polling question while we're thinking. Again, I would love, if you're willing to chat or in the question section, send in ideas that you have, ways that you're addressing service equity. And here we've got one coming in. We're working with HIV/AIDS and long-term survivors. Fantastic. We had not included that as a particular target audience, but that's definitely a growing population as we, with our aging population. That's terrific. All right, keep thinking of things that you're willing to share, but in the meantime, we've got a polling question for you, and that is, for which focus area are you feeling most confident about addressing service equity? And again, these are just the focus area from the area plan, but would be curious. And then we'll come back and read out a couple more. So you see the poll there and be curious about your answers. All right, and as people are still voting here, I can read off a couple other chat comments that have come in terms of ways that people are addressing service equity. People who are doing outreach on mental health and substance use disorder. Terrific. That's a great population to be reaching. There's a comment that transportation remains a challenge in connecting underserved people. For example, LGBTQ seniors in rural areas that can't access social groups with peers because they are held in urban areas. Great point. I think transportation is a barrier across the board, but particularly when we think about some of these more at-risk and isolated populations. The person who wrote that in, I would say I don't have any good answers on that, but it's a great thing to be thinking about, and then trying to come up with some strategies that you would include in the area plan. All right, are we ready to share, or did you, we could share that this was the response to the question on which focus areas you feel most confidence about addressing. So it looks like people are feeling pretty good about INA and the ADRC. That's great, followed by health promotion, family caregiving and nutrition services, and maybe least confident about elder rights and legal assistance, and partnerships with older Native American services. Great. Well, thank you for sharing that. Another comment that's come in, partnering with health departments to reach caregivers in non-English speaking communities. Terrific. And that's interesting. I wouldn't have thought of working specifically with health departments to reach caregivers, but that's great that that's working in your area. All right. Then moving on to, I guess, our second to last slide. And this is, again, a request to all of you that you can chat in by the question area, but is there further information that would be helpful to your AAA or to you in developing your area plans and in terms of your longer-term efforts to address equity? We'd be really interested in any further training, any further information that could be helpful. The webinar today kind of went across, focused on the area plan expectations at a broad level, but if there are particular areas where you think more information would be helpful, it would be great for us to hear that either now or in follow-up to this webinar. And the question chat section is fairly quiet at this point. We've gotten a comment that the format for the area plan makes it difficult to share with the community. It would be great to understand ways of sharing this plan with the public. Great point. And the area plan does become a public document. It's also something that we expect that you would be actively engaging advisory councils in helping develop. So it's an interesting question that the format itself makes that challenging. Great comment, and maybe it's something that I can follow up with the commenter offline to see if there are ways that we might be able to improve that over time. There was another comment about needing help pulling demographic reports out of Oregon Access. Great point. We'll make a note of it. It's not, I think Oregon Access is a challenge to most of us, but yeah, definitely let's see what more we can do with that. That's a great suggestion. Another comment, or maybe that's connected to it, I've heard that some LGBTQ seniors. I've heard from some LGBTQ seniors that outreach in rural areas is hard because many people may not feel safe making their orientation known within their small town. The recommendation was to have town, city, and county leadership make them feel welcome in a public way. Great point, and boy, what a great role for AAA if there are ways that you, in your advocacy role as AAA, that you can work towards engaging community leaders in making people feel welcome. There's a comment that I'm not sure. I'm looking to others in my group here. It says it can be shared electronically, and I'm not sure. It's over 90 pages, so it makes it challenging to keep people engaged. And this is the area plan. And Debbie McEwen, I think, is responding that the area plan is over 90 pages. No. Okay. Rebecca is, okay. So, sorry, we're having some more chat about the area plan and the challenges in making it engaging so that community populations, and particularly minority populations who may not be as comfortable with government-generated reports, can feel comfortable understanding what's being proposed and provide input. Again, really great point, and I think something that we can think about ways to try and make more user-friendly. All right. Any other feedback or requests? Really appreciate those of you who've been chatting in and providing us feedback. If not, I guess what I would say is, again, we're going to post this webinar and the PowerPoint to the State Unit on Aging website. You will also be getting a brief survey as we close out the webinar, and would really appreciate your feedback. That's another opportunity both for you to let us know about the webinar itself today, but also to raise any other questions of help or assistance that you might need. And if you have any other questions in the weeks that follow, please let your State Unit on Aging liaison know, or you're welcome to contact me directly. Any of those are possible, and we really appreciate the work you're doing and are looking forward to seeing the creative and ideas and plans that come in your area plans. Anything else I should be saying, Christy?
Just a reminder that the survey will be coming out from Lori Watt right after this, so please fill that out for us. And I think that's it. We'd like to thank Naomi and Teresa for being here today and helping us with this. We appreciate it very, very much. And I think that's it. So thank you all for being here, and we appreciate your time and look forward to reading your area plans. Thank you.